Here we have a patient in chronic pain. He has two major areas that I'm aware of. One is his neck, and the other is his chest. Perhaps you could explain to us how long you've had the feeling of things going down your arm and the side of your neck bothering you, if that's a true statement anyway.
Well, the part about things from the neck and pain down the arms, this goes back, I would say, 10, 15 years.
Mm-hmm.
And at that time, a lot of it was like a sharp pain going down. I would say in the last couple of years, it hasn't been that much. 2 years ago, when I was looked at by, when I had the MRI of the neck and the cervical spine, it did show some tears in the rotator, but they determined that that wasn't the pain. And there was extrusion at the C6-7, and I would have pain at various parts down here, and down the arm, and then into my hands. These would invariably go numb when I was sleeping, and subsequently, in the last 6 months or a year, I've been getting where these go numb, and I will have some less often, but pain down this arm that comes and goes. It can be in various points here, and sometimes I'll just feel like a tightness in here. I had that on Thursday, and even I had for quite a while, I think it's TMJ, but stuff in here where I get pains down through here, and weird head feelings, etc., etc. And they did give me quite a bit of anxiety, because I sometimes still get those, and I get them over here, and like a funny feeling in here. So they basically scared me.
Do these pains keep you up at night? In general?
They have, but not at the moment.
All right. Have you ever had any prolonged relief of this pain in all these years?
Well, the time that I did get relief was back, I can't remember how long ago, but it was, I'm going to say 10 years ago. It could be longer. And when I went for extensive treatment of prolotherapy. And
with Dr. Raushauser,
and I would say that I got good relief. At that time, I don't recall that I had
the chest component.
The chest component. That seems to be
So let's just say you got some relief a decade ago. When did it start up again, approximately?
Well, I would say, like all these things, they seem to come and go. But I would say it was very bad a little more than 2 years ago. And that's the time I went into the doctor with palpitations and there was a high blood pressure and and I was saying that I was having this shoulder arm pain, so they clicked it off and they did the test, and it was not a heart issue. They scratched that off, and they sent me for those two things to those two doctors. And you want me to tell you what the treatment was at that time?
Sure, go ahead.
It was essentially Medrol.
Dose back, yeah.
And that did take the pain away after a few days, and that allowed me to do about 5 weeks of a couple times a week physical therapy, and it was with exercises for posture and et cetera. I would do a new one every time. And I got relief from that.
For how long?
Well, that was, like I say, 2 years ago, and wear and tear and doing your exercises. This, I'm not really sure. This spring, I'd say it was coming back, and then I was having, kind of like all over symptoms and other things that knees and Achilles, etc. So sometimes what happens is whatever the pain du jour is, you focus on that
Okay. What about this chest pain? How long has that been going on? It's okay to point
Yeah.
where it is.
Yeah, I get various things in here
Uh-huh.
and in here, and for a long time, I feel a general tightness in the pecs, and it could be sometimes in the armpit or the other side there, and that I had, I would say before, but it's really been and then sometimes I'd get stuff over here,
Right.
and
But it's more so on the left, but it's kind of
it's
also
coming on the
gets
right,
on the
and I
right.
get, the
Pain
arm
down the
thing,
arm,
and then
yeah.
I'll get where it's like tightness, and I'm afraid, oh, it's something else, and then it's hard for me to say, but it's definitely been the last 5 months or something like
Right.
that.
And you've had extensive heart tests.
Yes.
And I think you've come to the conclusion, probably you're not 100% sure, but I think after we talk today, you probably are, that it's not your heart.
Yes.
Which is reassuring, but it doesn't
Yes.
get rid of the pain. The most reassuring thing is to get rid of the pain. And then you don't have to worry about anything. All right, so we're going to, I want to check a couple of things. We'll take another movie with where the pain is coming from, and then we'll get around to treating it. All right, so here we are before treatment, not surprisingly, with the neck pain. He describes he has a very restricted range of motion of his head, and that's a restriction that his neck is putting on him. So those are drop lines we did from the tip of his nose with him turning, pretty much as far as he can without hurting himself. And now we're going to mark the costochondritis. So at this point, I ask the patient to point where he feels most aggravated in the chest, and you can see above his left nipple, he's got an area. Does it feel kind of bruisey, burny, or sharp?
Bruisey, and I want to feel around because
Take your time.
And then in one down also, just to this.
Those
side.
are the most tender spots. Do they hurt you if you breathe deeply?
I don't. No, this is very tender right here.
Got it. Let me see. Now, don't you also complain a little bit that you feel like you can't get a complete breath? Is that something?
That's true, especially. I've been complaining about that for several years.
Mm-hmm.
But the thing is, it obviously comes and goes. But I would say it was extremely bad last night, throughout the night,
Mm-hmm.
and even into this morning. And I don't know if I attributed it to anxiety or the
Right.
reflux, the silent reflux, or whatever.
Okay.
But yes,
Well,
that is true.
And how about the right side? You mentioned that
Okay,
bugs you
yeah.
too. And by the way, you doing this is a little harder than me
Okay.
showing you the pain,
Is that
because
okay?
you feel a little different when you touch yourself with this. But is that about where it is, or
Well,
no?
I'm not feeling it right now, but
Okay.
I did feel it the other day. And the one thing I would say is a lot of times it has to do with the position you're in.
Sure.
So like if I'm like a
Then
certain
that
way-
grabs you.
Okay. No. So now I do feel it, right?
Let me move this hand.
The nipple in the
Area.
Yeah.
Similar to where the other one
Similar,
is.
yeah. It seems like this one is more
More
usually
intense.
worse.
Yeah.
And for some reason, I don't know if last night when I was
Got way down
lying
there.
down and I was feeling like, let's see, somewhere underneath. I was kind of surprised underneath the. Let's see
Mhm.
if I don't know if I'm feeling it right now.
Okay. Well, what we're going to do now is I'm going to check and mark up areas, and then we'll take a picture of that, and then we'll get to the business of treating it. So here we are after noting the areas of costochondritis. There's the areas on his neck that seem to be restricting him. And at this point, we're going to treat him and then see how he does. Here we are post-treatment. And what's interesting is you can see the red line, which is range of motion before, without making any extra effort. You can see he's gone a little over an inch on the left and he's almost 2 inches. He is probably 2 inches on the right. And it'll probably improve with some heat. And now we're going to check him out. So here we are after a therapy, and you can see that on the blue lines, he's gone another 1/4 inch out to maybe even an inch out on his range of motion on the left. So that's improving. These blue marks, these blue X's, is where we have uncovered some new areas of costochondritis, and he's got one more blue line anteriorly on the right. So we're going to treat that. Oh, so at this point we've treated all these areas. The linear marks on his chest are his range of motion, and what you can see on the right, he's actually gone to normal range of motion. On the left, he's darn close, and